Hey, Dr. C here with you. So why in the world is iodine controversial? The funny thing is that it's not, with the exception of within natural medicine. So in this video, I want to explain why there are contrasting views and go through where they came from, talk about their main premises, and just talk about the evidence on both sides and let you think this through and sort it all out. The gist of it is that a group of 3 doctors and one gentleman who's now deceased, they created a group of ideas, and they called those the Iodine Project. Whenever you hear people talking about things like you need more iodine to help your thyroid, or using urinary tests or blood tests for iodine, or chemicals blocking iodine, they all came from this Iodine Project. And these are ideas that largely contradict the full body of knowledge we have in iodine from the last century of research. And they're still kind of going around. They've been taken up uncritically by many doctors, and I just want to talk through all the points to answer all the questions. Often I'll get questions related to bits of this or parts of this, and I'll give partial answers or I'll answer it here and there, but this one I want this to be like just really thorough and cover all the bases so it's just really clear. So how does this come about? Let's talk through the progression of iodine and its role in medicine. So it's not a good thing or a bad thing, it's something we need. It's a nutrient, it's an essential nutrient. And apart from its role as a nutrient, it's a really useful chemical. Iodine is a strong free radical generator, and that gives it a lot of helpful properties. We see that there are these compounds called halides, which include iodine, but also include chlorine. So we use bleach in a lot of medical applications for similar reasons. Iodine also has a lot of effects on making mixtures be more smooth and have better textures. It's a good way to sanitize things and sterilize compounds. And it was widely used throughout medical history as early as it was discovered. It was used as an antiseptic, as an expectorant to get out thick phlegm, as a contrast agent in cases of radioiodine contrasts, and also, as just sanitizer, the way bleach has been used. Starting around 50s and the 60s, doctors got better at tracking things, and they started looking at were they seeing thyroid complications from various treatments. And more data emerged that iodine had side effects. And there's been this big trend that started then in which iodine's been phased out and used in fewer and fewer ways. Just one quick recent example of that, it was 2017, 2012, it was pretty recent that before then we did use iodine in some of the hand sanitizers, but the FDA found that hospital workers that were frequently using hand sanitizers were seeing higher rates of thyroid disease and unsafe blood levels of iodine. So that was the step that caused that to be banned, and now we no longer see it in those products. But that's one example of many in which ways it's been phased out of medicine. And there have been a couple of doctors in natural medicine who have been aware of the positive historical uses of iodine and hung on to those. And there's a valid trend because there certainly are examples of useful treatments that nutrients provided that just went by the wayside for no good reason. And so I think doctors saw that iodine's been less used and some of its applications that went by the wayside, I think they've assumed that they were just discarded for no good reason, that they could still be used in those ways. An example of one of the earlier doctors who wrote quite a bit about that was Dr. Jonathan Wright. And he didn't really have a detailed, complex system overthrowing the way iodine works in the body, but he really held on to a lot of the anecdotal historical uses for it. He talks about it being useful as a decongestant, topical against acne, in high oral doses for bladder infections, or it's used against fibrocystic breast disease. And some of these things have some documentation, some evidence, some not so much, but nonetheless, they were ways in which it was used historically, but again, have gone by the wayside because of the risks that we've seen. I've looked over some just recent notes Dr. Wright has put out. He's talked about using rather high doses of supersaturated potassium iodide, also called SSKI. And the potency of that, it's about 50,000 micrograms of iodine per drop. And Jonathan Wright has said that there's really, that it can be safely used in high doses, as high as like 45 drops per day. And this ends up being like over 2 million micrograms of iodine. And he does give caveats that there could be changes in thyroid function, but yeah, this is far above amounts that we consider safe. Just to give some framing and context for the rest of the discussion, the World Health Organization has said that those that do not have thyroid disease or are not prone to it may safely be exposed short-term to iodine as high as 1,100 micrograms per day, or 1.1 milligram. Those who have thyroid disease, the safe upper limit is probably more like about 200 micrograms. And as we go through some of these elements of the Iodine Project, they're commonly recommending amounts that can be hundreds of times above these safe upper limits. So the story about these issues now really start with Dr. Guy Abraham. Again, Dr. Wright kind of passed on some historical uses, but he never really questioned the way we know iodine works in the body or known risks or side effects from that. Dr. Abraham wanted to overhaul the whole thing. And the funny thing is that Guy Abraham's ideas that make up the Iodine Project, these are things that I was exposed to in the formative years. So his work was published between 2002 and 2008. That's when he was actively putting it out. Dr. Abraham has since passed away, just to make that clear. And I was intrigued by his ideas. The basic premises were that thyroid disease is really just a simple deficiency of a commonly available, inexpensive nutrient. And that was appealing. You know, I was already focusing on thyroid disease by then. I've been practicing for like 6-8 years. And how cool would that be if we could just have someone take a cheap mineral and have them get better? And I was also receptive to the idea that, you know, there's this mineral that's essential, that's helpful, but it's misunderstood, and that doses that are commonly used are far too low. You know, those are themes that are not foreign themes in the world of natural medicine. So it seemed plausible in a lot of ways. And then as I got exposed to more of his works and as I spoke to him more personally, some of the explanations made me want to just pause and, you know, hit the reset and think it through, you know, verify some of the claims and look at it more closely. And I'll give some examples of that as we go along. But he called this work the Iodine Project, and this was published in a magazine called The Original Internist. These articles are readily available online, I believe optimox.com, but you can find all these original articles. And the magazine is one that's, it's not a peer-reviewed magazine. It's primarily a trade publication for chiropractors. But he did this work in conjunction with a couple of other doctors. By and large, it was him, but then as he got going on this project, Dr. David Brownstein became involved, as did Jorge Fleckas and Dr. Charles Sakala. So these are the real core group behind that. For whatever it's worth, Dr. Brownstein has been the most prominent of those to continue, and he's since self-published a book that really recaps Dr. Abraham's work. The others have done a few things, few lectures here and there. Dr. Sakala has a laboratory that does some of the testing, but they're not as visible and not as vocal about these issues as Dr. Brownstein has been. So let me start by just summarizing the core claims in this Iodine Project. The first one is that iodine deficiency is rampant in America. And the second one is that the RDA of iodine at 150 micrograms is grossly inadequate, that adults need far more than that. They argue that adults need 14,000 to 50,000. So yeah, so it's not 150, it's 14,000 to 50,000. They argue we need that much more. And sadly, they've even argued that pregnant women and children also need these megadoses, and we'll talk about some case reports written in which there have been complications caused by these approaches. Next point they make is that iodine is essentially non-toxic. They do acknowledge that there are iodinated compounds, like those used in medications or those used in radioiodine contrast, that can be harmful, but they don't feel that any harm can really be ascribed to iodine. Next, they talk about halides, like compounds such as bromide and chlorine, and they argue that many ways in which we see thyroid disease on the uptick, or if we see negative effects from iodine, those are really problems from halides blocking the effects of iodine. Then they talk about, they argue that iodine cannot slow the thyroid. Paradoxically, we need iodine for the thyroid to work, but there's a phenomenon called the Wolff-Chaikoff Effect, which was first documented in the mid-40s, and it's a way by which a lot of iodine stops the thyroid. And if that effect did not occur, as we got exposed to higher amounts of iodine, our thyroid risks go out of control. So the body's got a built-in safety mechanism. But because this contradicts a lot of their ideas, these folks in the Iodine Project, they argue the Wolff-Chaikoff effect is not real. They've got a lot of articles called Crying Wolf. Funny, kind of a clever way to knock on that. Then they argue about the ways to evaluate iodine. How do you know if someone's low in iodine or not? And if we use the standardly available tests, we wouldn't really find iodine deficiencies occurring in the modern world, but they argue that urine challenge tests are better. They use tests in which people take a high dose of iodine, and then they measure to see how much iodine was recovered in the urine. And their logic is that the body holds on to it if it needs it. So if in the first 24 hours, not much of the iodine is recovered, it must have been necessary for the body. And then last up, they argue that yes, iodine can cause TSH levels to elevate, which is like moving towards hypothyroidism, but they argue that this is really just not relevant. This is not a bad effect. This is actually a good sign. So I'll come back and talk about each of those points by themselves in detail. There's a couple of miscellaneous, more minor points that have come up, and I'll address those too. We'll talk through all of it and give you guys lots of good references. So yeah, why have these ideas gone around so much if they don't fit the data? Well, I gave some senses of that before, one of which is that it's a familiar theme. There's some vital nutrient that we're missing. We just need more of that. And it's plausible because we do need iodine for thyroid function. It is essential that way. And last, I would say that it's palatable. It would be a cool thing if a cheap, easy fix could take care of a difficult problem. And people with thyroid disease, by and large, many have persistent symptoms. Most of them that are on conventional care have not recovered. So there's a lot of folks in need, and it would be great if we had an easy fix that was that simple. So how did he get these ideas? How did they start up? Well, Dr. Abraham was a gynecologist, and he talked about how he became aware of some of the studies on iodine lowering the symptoms of fibrocystic breast disease. And rather than just take it at face value and say, oh, this could be a treatment for this condition, he ran with that further. And he thought, if a high dose of iodine helps fibrocystic breast disease, then iodine deficiency must cause fibrocystic breast disease. But the amounts they used in the studies were so high, they were much higher than the RDA, then therefore there must be an issue with how much iodine people really need. So that was his thought process. And a little more depth about the fibrocystic breast disease. So we now know that breast tissue has a thing that concentrates iodine, and that's there like it is in the thyroid, but in the breast tissue, that's so that breast milk can have adequate amounts of iodine for the baby. And that concentrator is called the NIS, or the sodium iodide symporter. And the symporter, we know it shuts off in the face of massive amounts of iodine. We'll come back to that Wolff-Chaikoff effect, but it also occurs in breast tissue. So fibrocystic breast disease, there is this fluid buildup. And there's a lot of theories, but not like a clear, simple reason why it happens. But if you do stop that NIS, that sodium iodide symporter, you do lower the fluid content of the breast cells. It's basically stopping sodium from coming in. So you're taking some of the extra water out of these congested, swollen, tender tissues. So yes, we know that it works, but it doesn't work because it's not that fibrocystic breast disease is an iodine deficiency. And this is an example to where nutrients can work in multiple ways. Nutrients can be important keys that fit in certain locks that allow chemical reactions to occur. But biochemistry uses a small Lego box. There aren't all that many different things used in biochemistry. So nutrients can have multiple effects. One of my favorite examples of this is niacin. We need niacin for various chemical reactions. And it happens that in massive quantities, niacin can block the same enzyme that cholesterol drugs can block. It doesn't mean that those with high cholesterol are niacin deficient. It's more of a pharmacologic, sometimes useful side effect of niacin. And that would have been a more accurate interpretation about iodine's effects on fibrocystic breast disease. It's not that women who are iodine deficient get fibrocystic breast disease and iodine treats it. No, it's that that's a pharmacologic role that iodine carries. So from those studies, he did some speculation, and most of them used about 5 milligrams of iodine, which is still a whopping dose. But he thought that 14 milligrams was the amount that most adults would need. And here's where we start getting a little bit murky. The quantities of iodine that he considered were essential, if you run the math on the iodine in soil, the iodine in seawater, humans never would have had those amounts. We just don't have that much iodine on planet Earth. It's just not there. So it's hard to argue that a nutrient is essential for our bodies when we were never exposed to it in those quantities in the past. By and large, we adapted, we evolved in environments that supplied us certain nutrients. And there's a lot of cases in which we had higher amounts of like fiber or vitamin C or other compounds on our earlier diets than we have in the modern diet. But there's just no possible scenario by which we ever could have obtained 14,000 micrograms of iodine per day. It wouldn't happen. It's just not available on planet Earth. So he kept going though. He didn't want to let the speculation go, and he kept on thinking past that. And this is about the level of speculation where I started to get lost. And he told me these things in person. He's got these things in his writings. I'm going to share some quotes just to give some examples. But he argued that the Earth is about 6,000 years old, and that prior to the flood of Noah, that the amount of iodine in the soil was hundreds to thousands of times more dense than it is today. There's a few quotes I've got here. He said that the original planet Earth contained a topsoil rich in iodine. And then the gist of it is that the flood of Noah, he argued, took away that iodine, and it made it to where the Earth is in a whole different composition. Now, not even getting into the veracity of the flood of Noah, these are not things that biblical scholars have talked about. And I've asked friends who are in that category, and they say, no, there's really no mention or no thought about that being one of the relevant events. But his basic argument was that having more iodine in the past gave us more spiritual power to resist the dark forces. I don't talk in these ways, I'm sorry, but a lot of these are direct quotes. He argued that there was this big zombification, that's his word, that took place after this flood. And he also argued that America was a special place because we fortified our salt with iodine, and we did that for the deeper reason of blocking these dark satanic forces. So he talks too, there's a quote where he's saying that after World War II, we started losing ground on that. And he argues that a campaign that iodophobic misinformation with well synchronized with the introduction of alternatives to iodine supplementation medical practice strongly suggest a well-planned conspiracy by agents of foreign powers planted at strategic positions in academia and the regulatory agencies. So that's a quote. He's basically saying that there was a conspiracy to take away our iodine to zombify Christian America. And that's his quote too, by adding iodine blockers to our diets and lowering our iodine intake. And he argued that this effect culminated in work in the 60s that replaced iodine as a dough conditioner with bromides. So yeah, there's some quotes that I've got in the blog post too, and I reference all these things, but I don't know, unless you resonate with deeply held conspiracy theories and zombifying forces and whatnot, these ideas are hard to swallow. And this is where I started to part ways with this thought process. And I started just questioning it and then thinking through, well, what do we know about iodine and what has been studied in this last 100 years or so, what has come about? So his ideas, though, have really grown wings, so to speak, and they've gone beyond those core adherents. And now a lot of the generalized concepts of the Iodine Project, you'll hear talked about as if they're fact, as if they're accepted fact in natural medicine. Some of the general ideas that have really gained momentum are that iodine deficiency is common, that urinary tests are useful for iodine, especially the loading tests, that people with thyroid disease need more iodine, and that there's something uniquely toxic about the halides. These are ideas now that live well beyond just those core adherents. So the other thing that pushed me away from this world was, my patient care. So I was first exposed to this from coming across Dr. Abraham's work in some magazines and personal conversations with him. But soon after then, as his ideas were getting prominent, this was affecting people. And having a focus on thyroid disease, the way that works is, people come in obviously with thyroid disease and thyroid symptoms. There's few, if any, people over the years that weren't already diagnosed by the time they came to see me. And not only that, but most had gone through a lot of different treatment attempts. So, and then also many that have tried various treatment attempts and had that not go well, those are the people that take another step or another step. So I get to see the effects of a lot of different treatment approaches, conventional, and also a lot of different alternative ideas. So even ideas that I don't ascribe to or I don't do, I've seen how they work for people. I've just seen how they affect people. And one of the first examples I had was a gentleman that I'll call Richard. This was a guy who was a snowbird. He was in Michigan half the year and Arizona half the year. And really cool guy. He was like, just, I don't know, an inspiration to me as far as his commitment to his health, his fitness. He was in his mid-70s and yeah, just flawless physical specimen, inside and out. Really cool guy and super healthy. And one year he came down and he had a rare type of thyroid disease. And I've written about the story elsewhere. I won't give it too much depth, but the upshot of it was this came on after he was given a test telling him that he was low in iodine. And after he started treatment for this iodine deficiency, he developed this version of thyroid disease. And I had a lot of red flags going off in my head, a lot of question marks popping up. And so it turned out that he had had this iodine challenge test done. And that seemed to correlate with when his thyroid disease came on. And the doctor that performed that for him told him that he really needed the iodine. He was lucky they caught it. And maybe if he took enough of it, this toxic nodular goiter that he had, maybe that would go away, maybe it would stop it. But I knew that this type of thyroid disease was well known to come on after exposure to high dose iodine, and specifically after the doses as high as he was exposed to. So that was kind of baffling to me. And around the same time, there was more and more people rolling in who were hearing these ideas, or their doctors were, and they were being given massive doses of given massive doses of iodine, and then developing thyroid disease in response to it. One was a gal called Jenny, and she heard about us from a nearby health food store close to where the clinic was back then. And she had read something, she had a doctor that also did a test on her, told her she was iodine deficient and that if she treated that, she could lose weight more easily. She went in to see a naturopathic doctor because she was having weight struggles and she thought she may have had something wrong with her metabolism. And the doctor told her that her true problem was iodine deficiency. And she was checked for it and found not to have thyroid disease at that time. So within about the first, I think it was 3-4 weeks of treating her alleged iodine deficiency, she developed thyroid disease. She had palpitations, she had abrupt hair loss, she had mood changes, and she went to see her primary care doctor and got tested, and she had an early version of Hashimoto's called Hashimoto's, and she was suffering from that. And she, in her mind and from her doctor's training, she knew that the iodine was a factor behind that. And yeah, we know that can be a trigger as well. So also around this time, I was writing The Complete Idiot's Guide to Thyroid Disease. And I wanted to talk about iodine and I wanted to get it right. So I had numerous conversations with Dr. Abraham. And I really want to say he was a sweetheart. He was a really kind man. He was patient with me. He was generous with his time. Back then, his work was not readily available online, and I didn't even ask for it, but at his own expense, he mailed me a box with everything he had written on the topic. He sent that out right away and just did all he could to help me. And truth be told, I still feel bad contradicting him because he was such a kind, generous person. And I have no doubt that he was well-intentioned and he wanted to make a positive difference. But the more I went through the work, the more troubles that I had with it, So whenever you make a claim, if it's a claim that doesn't fit existing beliefs, you've got to back it up in some way. You've got to document things, you've got to reference things closely. So that's a big reason I wanted to see his work. I wanted to go through the references. I knew by the time he and I had spoke, I already had heard the main core claims by the Iodine Project, but I wanted proof either way. I wanted to know if this was true, and I really couldn't just take someone's word for it, especially when some of the premises were based upon conspiracy type ideas. So when I got his work, I took a look and put a lot of weight on the references. And the references were pretty much, they all fell into one of 3 categories, sadly. So one of them, they were very old. They came from the 20s, 30s, 40s. And even then, they were not so much based upon hard gained clinical conclusions. No, they were more so just speculations or observations. And again, they were old. So there were many things that people wondered aloud or thought about back then, but in the more recent years have found just weren't true. The other group of citations were animal studies or test tube studies. they weren't really findings on humans. And there's a lot of ways in which lab rats and other animals, they differ from humans in iodine metabolism. So we can't put as much weight on those. And then the last problem I had with the references is that many were circular. So what I mean by that is in one passage, he would give a reference for a statement, and that reference would be one of his other passages, one of his other writings. And then if you go to that writing, the reference in it was the first writing. So basically saying this is true because I said it was true back here. And then back here he's saying this is true because I said it was true over there. I'm like, it doesn't work that way. So yeah, references can't be circular. They can't be to your own statements. They have to have some external basis. And better references are newer, not so much older, and they're based upon humans and they're based upon clinical outcomes. So I provide an example of a group of his references, and you can just see I've highlighted all the ones that reference himself, and they're just referencing his statements in his other articles. They're not even, those statements are not referenced any differently. It's not that that's the basis of it. Or I highlighted the dates for those. Many were from even 1917 or 1920s, or they were just not relevant. They were animal studies. So when I looked through the citations he had, I didn't really see that it supported the claims. And then the more I thought about that, the more I started looking outside of his work to see, well, what do we know about iodine? And is there more of a story here than people are commonly hearing? Is there something interesting to find? And yeah, that got me going on a journey that I'm still on, and it's still intriguing. From the gist of that, what we found in this last century is that iodine is pretty fascinating. And of all the known nutrients, it's got the narrowest range of a helpful dose below a harmful dose. You know, how much do you need before you're too low, and how much can you take before it's harmful? And I wish those two numbers weren't so close together, but there's just lots of data saying that those numbers are close together. And it turns out that you can be harmed by too little iodine, by too much iodine, or by too big of fluctuations of iodine. So even within that narrow range, if you're up and down really erratically, that by itself can be a problem. Or even if someone might not be harmed by a certain amount that's above the range, if they go up often and they fluctuate a lot. So even just the fluctuations can be a problem for people. And a quick overview, our best knowledge now tells us that people with general health that could be at risk for thyroid disease probably are best to be between about 50 and 200 micrograms of iodine per day for adults. Pregnant and lactating women, they need a little more. We think that's about like 150 to 250. Now, that is narrow, and I wish it wasn't so narrow. That's just not cool, but that's what the data tells us. And then the other thing we know is that it seems that there's this opportunity to often reverse thyroid disease by being at a lower window, and that's probably about 30 to 100 micrograms per day. So let's dive into all these individual claims. And I'll hit the main ones that I mentioned before. There's a couple other ones that came up after the fact that were just not as commonly made, but lended support to the argument, and I'll address those too. Okay, so buckle up. We got a road trip ahead of us here. And you know, if you want to just get to the punchline, I've got that too. That's at the end of the blog post, or you can skip near to the end. But for those that really want the details and want to hear the nitty-gritty about this, I'm covering all the bases, because my thought is, truth be told, I spent a lot of time answering questions about this stuff and repeating myself and talking about these ideas that are just not solid, and I kind of want to be done with it. So I'm going to use this video a lot. I'm just going to say, look, go check this out. Here, I'll give people a quick answer and say, go check out the video for the full answer. So here we go. Here's the full answer. So the first claim that they made was that iodine deficiency is really rampant. And specifically, they've stated that the US iodine supply has gone down by 50% or so in the last 30 years. I've seen different numbers that they've quoted, but they're often about in that range. Sometimes they'll say 60% in 40 years. But they argue that it's kind of a funny thing, because on one hand, they are happy to reject all the classically known ideas about iodine. But if they think any of the conventional ideas support them, they'll grab onto them. And this is an example of that. So yeah, there are data points showing things along those lines, that specifically between about 1960, 1970, and up to about the early 80s, that the median iodine levels did go down. Now, they were blatantly excessive at about 320 by some of the NHANES studies, and some of the follow-up NHANES studies in the 80s saw them go down to about 170, which is generally in target. So it wasn't that we became deficient. Our levels did lower, but they went from a radical excess to more of a reasonable amount as a median. And we'll talk more about some details by which medians and averages can be deceiving. I heard one scientist say that you could have your head, this is kind of an awful visualization, but you could have your head in an oven that's turned on and hot, and you could have your feet in an ice bucket, and your average temperature could be perfect, But nonetheless, there's problems on both ends. And so what we're seeing in the US is that, yeah, our median has been kind of like that in that time frame. The median has changed since then, and there's many subpopulations that have extremely different levels that are significant. So we'll talk through those more in greater detail. So yeah, the averages did go up in those time windows. There's one graph that I'm putting up here, which is just showing how the median iodine levels from the late 80s to the early 2000s, they've gone up. So we're not at a deficiency state. We never were in any of these at an overall state of deficiency, but they have gone up. If anything, they've not really gone down in the recent past. Now, the World Health Organization, they take a close look at varying types of iodine ranges, how they affect human health. And their argument is that the US right now is one of the countries that's at excessive levels of iodine, that we're at an unsafe level of iodine. So what they've shown too is that when you look at the US population, there are certain subgroups that are at clearly unsafe levels, where they're above 200 micrograms per liter for their average urinary iodine levels. We'll talk more about the testing, but quick note is that there are many tests of iodine that are accurate for population analysis, but are not accurate for individual analysis because there's just too much fluctuation within one person's samples. Those things level out in a big group, but they can't apply well to individuals. So now if we take a look at women and men between the 20s and late 60s and different ethnic groups, we see that many of these subpopulations have way too much iodine. Like, for example, I'm just glancing here. So women who are non-Hispanic Black women, for example, that are 50 to 59, 37% of them are at unsafe levels of iodine. So an average wouldn't capture that. So our average is a little bit above what's safe, but in subgroups, it's even worse. So the subgroups can be quite distinct. And then some are even higher than that. And this is why, yeah, not everyone gets the same amounts, and not everyone gets thyroid disease. So that's the big distinction there. And then a lot of the talk too that they've discussed is how levels have gotten lower in pregnant lactating women and how bad that can be. And this sounds plausible, and there have been historical examples of women who were pregnant that had too little iodine and that had negative effects upon the fetal health. But those numbers are all being reevaluated, and we now know that those situations were real outliers in the modern world. In general, the needs during pregnancy are different because there's this transition that goes on to where in the first trimester, the baby's thyroid hormone comes from mom. During the second trimester, there's like a passing of the baton to where the baby starts making his or her own thyroid hormone and mom has to make less. And then finally, in the last trimester, the baby's generally making all of their own. And so the baby needs iodine for that production. And then mom, in the earlier stages, needs to make extra amounts of thyroid hormone to help the baby because the baby's not making their own. And when there are severe deficiencies of iodine, that can cause cognitive delays, that can cause mental damage, that can cause windows of opportunity to close in which the brain's never properly developed. Now, in the recent history times, that's happened a couple times. So one was in Papua New Guinea, and this was in the 1960s. And then one was a remote area of China in the early 90s. And these were both areas that had endemic cretinism. So endemic just means like a lot of it. And cretinism is a congenital disease from iodine deficiency. So in these areas, there were complications from iodine deficiency for pregnant women. But areas that have even mild to moderate iodine deficiencies, we don't see those same developmental delays. And then the question is, how much do pregnant women need anyway? What is best for them? It used to be thought that they needed more like about 290 micrograms per day, but emergent research is showing that they are also vulnerable to the harms of excess iodine, and that 250 micrograms is probably a better safe upper limit for them. One quote was saying that the risks of even mild excess in pregnancy need to be carefully considered. The lowest prevalences of hypothyroidism, hypothyroxanemia, and thyroid autoimmunity, as well as the lowest levels of serum thyroglobulin, they're observed in women in which they're getting about 150 to 200 micrograms of iodine per day. And to be really precise, that quote's talking about a urinary to iodine creatinine ratio. They're not talking about oral intake. But for women, the urinary iodine creatinine ratio of iodine is a pretty close approximation of oral intake. So just to make that distinction. So specifically, they've shown too that the complications of iodine deficiency in pregnancy show up when mom gets below about 50 micrograms per liter of the urine, so around 50 micrograms per day. But nonetheless, we want some buffer so that wouldn't happen. So most experts are now saying that probably 150 to 250 is that best range for pregnant women, and that's where they are, that's where most of them are. Some can get low, that can be a problem. That's probably between about 4 to 7% of the population, and it's more prevalent in those who are vegan on very narrow diets. So it can happen, but by and large, it's not an issue for the average woman. And then the last question, because there is a lot of talk about iodine with pregnancy that has been mentioned in the Iodine Project, should pregnant women be supplementing with iodine? And this has been looked at really closely. To date, 70% of OBs or midwives do not recommend iodine supplements for preconception, pregnancy, or lactation. The American College of Gynecology does not recommend it. The American Academy of Clinical Endocrinology, they state that any considerations of iodine should be contingent upon the iodine status of the region. So if you were in a pocket that had endemic cretinism and congenital hypothyroidism, it could be considered, but in other areas it would not be. And finally, the American Thyroid Association says that without there being clear evidence of iodine deficiency in the United States, and with the median levels of iodine for pregnant women being in a healthy range, there's really no strong support that iodine supplementation during pregnancy is tenuous at best. And then a group did a review of all the known studies on iodine supplementation during pregnancy. This is called the Cochrane Review Board. And they basically pulled together all the current data from the last decade and said, what do we know about this? Is this important? And what they concluded was that iodine supplements in pregnancy can worsen nausea and vomiting. They can raise the mom's thyroid antibodies, but they have no useful effect upon thyroid disease amongst the mother. They don't affect the rate of preterm births. They don't affect the baby's risk for thyroid disease. And they're not even helpful in cases of preterm infant birth. So they're not a benefit. And I'll talk about this more, but the Iodine Project, they encourage these massive doses for pregnant women. And sadly, even the regular doses are now no longer being recommended. And these high doses can have side effects. And there have been published cases about women taking the supplement called iodoral that Dr. Abraham formulated and developing congenital hypothyroidism amongst their infants, which is catastrophic. So, and then finally, just to recap globally, the idea about iodine deficiency, that's changed. You know, as recently as 1990, we had 112 countries that were considered severely iodine deficient. But by 2014, that number was down to 0. But by then, there was 52 countries that were considered at risk of thyroid disease for iodine excess. And that's the US being one of those examples. Okay, so that was about us being low in iodine. The next point they've argued is that the RDA is inadequate, that adults need much more than commonly recommended for iodine. The RDA is 150 micrograms, and those in the Iodine Project argue that we need 14,000 to 50,000 micrograms. So again, the sweet spot that we see is between about 50 and 200 micrograms per day. There's a really good book called The Comprehensive Manual of Iodine, and it's a pretty massive thing. You could use it to stop your truck from rolling downhill. It's this huge, heavy book. But this slide that I'm showing right now, this is a compendium of hundreds of human studies of different populations showing the risk for thyroid disease based upon the amount of iodine exposure. And what we see is what's called this C-shaped curve or this J-shaped curve, to where with severe iodine deficiency, there's greater risk for thyroid disease. But also with iodine excess, there's risks for thyroid disease. And that window translates to our window of about 50 to 200 micrograms. And the World Health Organization has separately looked at this issue as well. And they've been giving advisements on countries that consider fortifying with iodine and watching what happens when those do or countries don't. And they've mapped out how different levels of iodine intake correlates with different types of thyroid disease. So what they call iodine level 1 is probably under 20 micrograms per day. And that's a problem. So when you hear about iodine deficiency and the issues with that, that's iodine level 1. That's like fewer than 20 micrograms per day. And at that level, there's endemic goiter. The neck enlargements are highly prevalent in the population. There's congenital hypothyroidism, meaning babies are born hypothyroid. And there's also higher rates of cretinism. These are things that, again, do not exist on planet Earth anymore. There were pockets in the 90s, the most recent, but those have largely been resolved. Then we've got iodine level 2, and this is between about 20 and 49 micrograms per day. Now, this is kind of a weird thing because at this level, this is considered a moderate iodine deficiency. The first was considered severe iodine deficiency, and again, there's no countries in this range as of 2014. We've got a few countries at the level of moderate iodine deficiency. And at this moderate level, level 2, there are higher rates of goiter amongst children. We do not see higher rates of congenital hypothyroidism, and we do not see cretinism, but there are more children that get goiter, that get a swollen neck. However, this is where we have amongst the lowest rates of adult thyroid disease. So kind of a bizarre overlap, but it's true. So children may need a little bit more proportionate iodine than adults might, but adults have the lowest rates of thyroid disease here, or amongst the lowest rates. Then we've got level 3, and this represents between about 50 to 99 micrograms per day. Here's where we've got low rates also of thyroid disease, and also where we can see the reversal of autoimmune thyroid disease. Level 4 is between 100 and 199. This is also an area with low rates of thyroid disease, not quite the lowest. Level 5 is between 200 and 299 micrograms per day. And this is where the United States is currently. And this is where we see higher rates of autoimmune thyroid disease. We see higher rates of goiter, hypothyroidism, and iodine-induced hyperthyroidism. So this is the first level of excess. And again, this is above 200 micrograms per day. And there's people telling you that you need 14,000 micrograms per day. This just makes me nuts because it's just, we've got all this data, all this science behind it, and people are saying that something's so totally different. And then level 6 is where they got the worst thyroid excess. And here we see all versions of thyroid disease and also thyroid cancer really picking up. And that's above an average of about 300 micrograms per day. So put all this stuff together and no, I wouldn't overhaul the RDA. I would not throw it out, and I would not say that adults need massively higher amounts of iodine. People have gotten higher amounts of iodine. We've seen what happens. We don't need to rerun these experiments. They've been done. We've already seen the results from that. We want people to be in the lowest risk for thyroid disease, and that's going to be between about 50 to 200 micrograms per day for adults. Okay, next claim that the group has made is that iodine is essentially non-toxic. Now, this is a quote, they've said that the toxicity of iodine depends upon the form, that what they call the man-made forms of iodine are extremely toxic, whereas the inorganic versions are extremely safe. Now, what they call the man-made forms are basically iodine in drugs like amiodarone, or radioactive iodine used in ablation, or other versions of synthesized iodine. And what they're calling the natural forms of iodine are iodine as it occurs in natural sources, such as potassium iodide, iodine in Lugel's solution, iodine in foods, or iodine in supplemental form. And they're arguing that these forms are extremely safe. So we've got a registry of all known chemicals and all their toxic profiles. And from that registry, they've got a lot of entries on iodine. And what they've shown is that iodine, when it's orally taken and oral exposure, has systemic effects that can be harmful on the whole body in high doses. This can include obviously the thyroid gland, but outside the thyroid, it can affect the skin, the heart, the lungs, the kidneys, the intestinal tract, the liver, the blood, the neuromuscular system, the brain itself, the skeleton, the reproductive organs, and finally the pituitary and the adrenal glands. And just kind of a sad example of how clearly iodine can be toxic, I didn't know this until putting this paper together, but one of the most common means of suicide is iodine overdose. I had no idea, but that's tragic. But yeah, you can, I hate to even say this, but yeah, over-the-counter iodine has been used in those ways. Now, thankfully, it's often not effective because it often is a strong emetic. When you take like a whole bottle of it, you'll probably puke most of it out, and if you do, that'll save you. But just a clear example of how it can be toxic is that, yeah, people overdose on that all the time. And there have also been many published case stories on people who were not overdosing, but were just taking supplements as recommended by the Iodine Project, and they developed thyroid disease. So there's a product called Ioderol that Dr. Abraham formulated, and this contains between, the two potencies that are most commonly available are 12.5 milligrams or 12,500 micrograms, or 50 milligrams, 50,000 micrograms. And if you go onto medical databases and you put in Ioderol, you won't find glowing reports about all these ways in which it's revolutionized our understanding of iodine, but you will find case reports of people who have been harmed by that. Just one example here. There was one case report showing that severe symptomatic hypothyroidism was induced in 2 patients after following the ingestion of Ioderol. And I've got some references for that. So the part that just freaks me out the most too is that one of the books that Dr. Brownstein has out, a self-published book on iodine, he assumes that since it's harmless, pregnant women should take the same recommendations. And he's encouraging that pregnant women take between 12,500 and 25,000 micrograms of iodine daily. It's printed, it's in the book, I've referenced that. And there are also published papers on which pregnant women did just that, and their babies had birth defects. So I'll come back and talk about that, but it just turns my stomach. And again, I'm so conflicted because I hate to engage in conflict, but people are being harmed by this. And the data is clear that it is toxic and that these are not safe amounts that they are advocating. So there's just strong evidence about that. Okay, so next point is that they argue urine challenge tests are the best way to evaluate iodine levels. Here's a little more about their mindset. So the mindset is that they have someone take a very high dose of iodine, normally it's 50,000 micrograms, and they have them do a 24-hour collection of urine afterward. And the thought is, if someone's body has enough iodine, they will pee all of that out. They won't hold on to it. Now, in truth, we do eliminate most iodine that's not needed through our urine. That's normal. However, the question is, when our iodine intake changes abruptly, how quickly does our urinary output reflect that? How quickly do we reach a steady state? They're assuming that whatever you didn't pee out in a day, you must have wanted. But let's think about that in terms of something that could be an overt toxin like mercury. You know, if someone had let's say they broke a thermometer, this is just a horrible thing. So I didn't even say this, but if someone broke a thermometer and they had, 2 milligrams of mercury in that thermometer, and let's say that they inadvertently rubbed it in their hands, they absorbed those 2 milligrams of mercury. So, or let's say they took it orally, if that's a useful difference as well to make it more of a close analogy. If they didn't pee out 2 milligrams of mercury in 24 hours, does that mean their body wanted those 2 milligrams of mercury? It would not. And we know that minerals and fat-soluble vitamins are not readily water-soluble. We know for sure that if someone were to take a massive amount of zinc, if it was more than they needed, they wouldn't pee it all out tomorrow. Or if someone took a massive overdose of vitamin D, even if it was more than they needed, they wouldn't pee it all out tomorrow. And the study, I heard a great quote from, I can almost think of who it was, but I'm not clear. But the great quote was basically saying, I don't need evidence to refute your claim if you have no evidence to support your claim. So I've got evidence anyway, but I can't find any evidence to support the claim that this test is accurate or valid or clinically relevant. I can't find any whatsoever apart from the fact that they've used it and they've tracked scores on people by doing this test. But there was a group that wanted to see if this test was meaningful. There's an image that I'm showing you right now, and this was a study done specifically on this test to see if it was valid. And what this graph is showing is how much urinary iodine elevated in this window of time after the test. And what you're seeing here is that someone took a dose right here at time 0, and they did this 24-hour collection in the following hours, so in this window where it's circled. However, their urinary iodine levels really spiked after about 30 hours, and 30 and 40 hours were the highest. And they continued to stay high as long as they kept checking 100 hours later. So like, 4 or 5 days afterward, they were still peeing out tons more iodine than normal. So it didn't all show up in the first 24 hours, and that wasn't because they needed it. It's because they hadn't had a chance to get it out yet, because it was so darn much and it was so toxic. So this test has been evaluated, and the whole rationale behind it was found not to be valid. But even before this study was done, we knew that wasn't a valid idea, because we've seen that populations, you look at the urinary iodine in a population, and we've looked at populations when they've had their iodine intake shift, like after salt fortification. And we know that it takes 3 to 6 months for urinary iodine levels to reach a steady state. It doesn't happen in 24 hours. So the 24-hour test is just not a valid tool. Now, many in this group have also talked about serum tests for iodine. And serum tests, or blood tests, they exist. I've looked at those. If they would have been useful, I would have used those. They are useful for determining to see if symptoms come from massive iodine overdose. There's a medication called amiodarone, and it has whopping amounts of iodine. And there are times where when someone takes it, they have side effects that they're not sure if they're from the iodine or from other things. So in those cases, they can take a blood level of iodine and see how high the person is. Now the blood levels, they're not linear. It's not that you've got, you take 100 micrograms per day, 200, 300, 400. They're not like that at all. They stay totally flat until someone's horribly toxic, and then they spike. And by toxic, I'm not talking about excess. I mean like where it's going to shut down your kidneys. That's when blood levels start to spike. Before then, your body does its best to keep the extra iodine out of your blood. And so too, blood levels are just not accurate tools to show iodine deficiencies. They're not meaningful in that normal range or even in the low range. So yeah, blood tests are not helpful. Now, urine tests are also used quite a bit without challenge, but as I mentioned before, they're only accurate if you're looking at large numbers of people. There's one exception, and that's the urinary iodine to creatinine ratio. It's not a perfect test for individuals, but it can help you categorize someone in one of those World Health Organization iodine levels. So it won't say precisely how much you have, but you can meaningfully know which of those levels you currently fall within. But that's not a regular urinary test. That's a urinary test that's calibrated against creatinine. And those are available. I'll be sure that we get links for that if anyone is interested. But the challenge test is not a valid tool. It's been looked at. So then the other big claim they've made is that your body needs, that iodine is necessary and helpful in massive amounts for thyroid function. And there's an image here I'm sharing which just shows how iodine is one of the biggest inducers of damage to thyroid cells, and that there's this whole cycle of events that go on that cause extra iodine to come into the gland. And what it does is that it makes it to where there's oxidative stress. Basically, iodine and iodide are different. And in almost all cases, iodide is the form of iodine that's found in food or is circulating within the body. The one exception is inside these little clusters of thyroid cells. So you take iodide from the outside and you convert that to iodine within these cells. And you do that so it's reactive enough to bind onto thyroid proteins and make thyroid hormones. But iodine, it's volatile stuff. It's like the ultimate free radical. And so when there's even a little bit too much, it shuts down the thyroid, it damages the cells, and it triggers the immune response. And these are all known effects. It causes oxidative damage, it causes cleavage to the cells, it creates more antigenicity, which means that the normal thyroid protein, thyroglobulin, looks foreign to your immune system. And now your immune system attacks it. And this is more common for certain genotypes, but that's the issue there. And also we think about just the effects that have happened among nations that have undergone thyroid fortification. So Denmark being one of the biggest examples of that. We see that when they fortified in the year 2000, they had 15 years running of about a 50% increase of overall thyroid disease, and also increases of need for thyroid medication and thyroid procedures. So we've seen this over and over again. We know that these excessive amounts are not helpful. Okay, so next point, the Wolff-Chaikoff effect. The way that a massive dose of iodine can slow the thyroid, they've argued that it's not real. And they argue against that because it really does get in the way of their belief. We know that a high dose of iodine actually doesn't help the thyroid, it shuts it off. And Guy Abraham has called this crying wolf. And the argument that they make is that there is a massive conspiracy. He calls this iodophobia, or iodine fear, and that the conspiracy is made to keep Christian America hidden and in a zombified state, and that the Wolff-Chaikoff effect is a big scam that's made to help people be fearful of iodine and avoid it. So he's criticized, Dr. Abraham wrote a blog post in which he argued that the original study that Doctors Wolff and Chaikoff wrote, that the study was not valid. And Dr. Abraham claimed that the supposedly inhibitory effect was not valid because the rats didn't become hypothyroid and because thyroid hormones weren't measured in their plasma. And looking at that criticism of the study and then reading the actual study, which I found the 1948 study, I can't imagine that someone would make that criticism if they read the study, because the study wasn't done to see if the rats got hypothyroid. And it just wasn't done over a time frame for that to emerge, and they weren't even measuring thyroid function on purpose. What they were doing was looking at how different plasma levels of iodine were affecting the production of thyroid hormones. And they were looking at that within the cells, how thyroid hormones were being bound and how they're being metabolized. And what they saw was that that massive amount of iodine, that high amount, when the plasma levels were high, thyroid production was stopped. And when the plasma levels of iodine came down again, thyroid production picked up again. And so it was quite clear. But they weren't wanting to see if the rats were becoming hypothyroid. And Abraham went on to say that, to the disgrace and stupidity of the medical profession, US physicians swallowed the Wolff-Chaikoff forgery uncritically. So before then, before the work of Wolff and Chaikoff, yeah, I mentioned how iodine was used in a lot more ways. Doctors weren't as clear that it could be harmful for the thyroid. They knew that we needed some, but they didn't know how a massive amount of iodine could be harmful for it. But that study by itself didn't so much shift the tides against iodine. Before then, there was speculation that something like this was happening. And doctors were already observing there could be harm in those receiving higher amounts of iodine. So that was just one piece of a lot of parts of data. Before Wolff's paper, there was another mechanism talked about in 1944 as well. And to this date, there are some things still that we're not clear on the exact mechanisms of how this happens. We know it does happen, but we now know that that many who do have this thing occur, they don't bump out of it. There's a phenomenon called the escape mechanism by which the Wolff-Chaikoff mechanism stops. So in many cases, after the high dose iodine is passed, normal thyroid function returns. We now know that many don't have that good outcome. They stay hypothyroid long term. And we also know that the Wolff-Chaikoff trigger, the way it slows the thyroid is separate from autoimmune thyroid disease, but they can often overlap. So people can have their thyroid slow down and they can be triggered into autoimmune thyroid disease simultaneously from this high dose iodine. We've also learned that this effect is not all or nothing. So it's not so much like just a massive amount shuts off your thyroid. We also know that smaller excesses can slow the thyroid. So not just like a full stop, but more like a braking action. And we also know that people can have the opposite effect, that there are those to where a high dose of iodine can cause their thyroid to become overactive. And this is more common in those that have thyroid antibodies or have goiters or have thyroid adenomas. But it can play out in all ways. So many who are exposed to high dose iodine have nothing happen, but many can have their thyroid slow down. For some of them, it can be permanent. And for some, it can become overactive. So how do we know this thing is real? Well, we use this medically. So when someone has Graves' disease, one of the most dangerous situations is a thing called hyperthyroid storm. And that's where the thyroid makes so much hormone that someone could die from that acutely. And there are medications that slow the thyroid, but they take weeks to work. So in acute hyperthyroid storm, what's going on is the excess thyroid hormone is causing more of the autoimmunity, which causes the thyroid to release more hormone. So it truly is a storm. It's a vicious cycle. And the thyroid blocking drugs, they would do nothing for weeks. So the only way in the moment you can stop someone's thyroid from being overactive that badly is by giving them massive doses of iodine and by triggering the Wolff-Chaikoff effect. And that's done just daily in emergency rooms across the country. It's a safe, reliable mechanism in that situation. We also know that this is real because that's the basis for radioiodine prophylaxis. So during the Fukushima disaster, for example, there's a lot of talk about taking iodine to protect yourself. Well, the reason taking iodine could protect you against radioactive iodine is the Wolff-Chaikoff effect. Basically, taking iodine and shutting off your thyroid for about 3 weeks could make it to where your thyroid wouldn't absorb the harmful radioactive iodine that might be coming. So that's the thought behind that. And then the last reason we know this works is because congenital hypothyroidism can be caused by maternal exposure to excess iodine. So moms that are exposed to too much, they can have babies that have thyroid disease. And there are published studies that have reported 3 infants that had congenital hypothyroidism detected because moms were taking iodoral pills. They were taking 12,500 microgram iodine tablets. And the babies were born with congenital hypothyroidism. The babies had iodine levels that were 10 times above controls. So they were iodine toxic because mom was taking so much, and it shut off the baby's thyroids. So the Wolff-Chaikoff effect can also cause this to occur in babies. And that's happened, and it's tragic, and it's not necessary because we know it's a risk. And these people are saying that it's not a risk. They're out there saying that pregnant women can take this much iodine and they should. And there's published studies showing that, yeah, women have been detected from doing that and they've had unhealthy babies from that. So it's not okay. This is not something that people can have. It's not like just differences of opinion like vanilla and chocolate. That's not what facts are about. These are real things and there are some clear differences, and this is one of those. It's not safe for women to take this much iodine. You can develop thyroid disease by taking too much. You can cause permanent harm to your babies by taking too much. It's already happened. We don't need more of it. And that's why I get lit up about this. So, we also know this is relevant because of that medication I mentioned, amiodarone. So each 200 milligrams of amiodarone has about 75,000 micrograms of iodine. And amiodarone takes about 6 months to leave your body after you've taken it. And we see that people on this medication have extremely high rates of developing thyroid disease. More evidence for Wolff-Chaikoff. We've seen that those that have normal thyroid function and no thyroid disease, but who are exposed to high amounts, they can still develop hypothyroidism once their urinary levels of iodine get high enough. And this happened not that long ago in Slovakia. It was well documented. We've also seen that endemic goiter, that enlargement of goiter in kids. Remember how that happens when the people are below 20 micrograms of iodine per day? It also happens at iodine excess. And that's the crazy thing about iodine is too much can do just what too little can do. And so one area in which children were exposed to high amounts of iodine, 64% developed goiters. They had endemic goiter in that area from iodine excess. This is the Wolff-Chaikoff effect. This is the harm of too much iodine. And yet people can be different. So there are variances in how this works, but the harm is possible. And that's the thing that bothers me too, is that risks are things that don't always happen, but it doesn't mean that they can't happen. It doesn't mean that they're not real. There was this sad joke about a man who fell off the Empire State Building, and he was, fell like 80 floors, and so far so good. Nothing bad had happened so far, so he must have been in the clear. Well, of course he wasn't. And that's the way risks are. You could drive without your seatbelt or drive drunk, and 9 times out of 10 you could do fine. But it's still not a good idea. And it's the same way about iodine. Okay, so next big point that they make is that halides, certain chemicals, can block the effects of iodine. And in the Iodine Project, they argue that any possible apparent side effects from iodine are really effects from iodine pushing out halides from your body. So that's kind of their idea. Now, the one truth is that fluoride is a halide, and it does compete with iodine for that sodium iodide transporter. It does keep iodine from getting in by using up the transporter space. And fluoride was used in the past as a treatment for hyperthyroidism. Now, thankfully, the amounts of fluoride we're exposed to in normal foods, fruits and vegetables, fluoridated water, dental treatments, the amounts are far too low to have effects on the thyroid function. And this has been studied just ad nauseum. There was thorough studies in Canada, the United States, and China, and yeah, fluoridation doesn't change thyroid function. Doses of fluoride way above 5 milligrams a day can, but we just don't get exposed to that much from these contexts. So chlorine is another halide that these people talk about. And this has been studied as well. And high amounts of chlorine, especially if you're exposed to them from pools, especially indoor pools, they can cause respiratory irritation. But even massively chlorinated drinking water or chlorine from pools, no effect upon iodine metabolism. There's no competition. There's no way that chlorine offsets iodine. And the one they talk about the most is bromine. And I'll mention that a bit here, but bromine's been so well studied. There have been studies in which they've given people pills with massive amounts of bromine, and they've closely tracked their thyroid function. One was a blinded study. It went on for 12 weeks, and the amounts of bromine people were given in pills was about 300 times more than they would ever get from Mountain Dew or other sources of brominated compounds. It was way above that. And they closely tracked all their thyroid markers. And exactly nothing happened. There was no effects. There might have been some positive changes to thyroid function. They were subtle, but there was no negative changes whatsoever. A different study in which people were given a high amount of bromine, they saw that women had higher T3 and T4 levels after being given bromine than before. So there was a quote that Dr. Brownstein had in a book saying there's no known therapeutic value for bromide. Therefore, any level of it could possibly cause problems. Well, that was written, bromide is now considered the 28th known essential element. It turns out that collagen formation and type 4 collagen formation depends upon bromide. It's something we need for our bodies to work properly. So kudos if you're hanging in there still. Next big point that's been made in the Iodine Project is that iodine does cause high TSH, but that is not relevant. And quick recap, so TSH is a backward marker of your body's overall thyroid hormone status. So as it gets higher, your thyroid is more underactive. And due to the Wolff-Chaikoff effect, many who take high amounts of iodine end up being hypothyroid. And those in the Iodine Project have just, it's undeniable to them that it happens, but they argue that if it does happen, then it's not important. Well, we know otherwise. TSH elevation is not a good thing. It means that you are getting hypothyroid. It's the earliest sign of your body's thyroid function slowing down. The T3 and T4, they are called the lagging indicators. What that means is when your thyroid first starts to struggle, the first step is your brain induces it to work harder. Your brain yells at it, and that's the TSH getting higher. So when it's struggling, but more or less keeping up, the free T3 and free T4, they don't change, but the TSH gets higher. So this is the first stage of hypothyroidism, and it's not a positive thing. And I've got references showing how the amounts of iodine excess that are much lower than what they're proposing, even much more minor excess, have been documented to be triggers for hypothyroidism, hyperthyroidism, goiter, autoimmune thyroid disease, nodules, thyroid cancer, and as we mentioned, fetal congenital hypothyroidism. These are all clearly caused by too much of it. So that's kind of the core claims behind that, but I look to make sure that I'm not missing anything because again, I want this to be exhaustive. I want this to be like my mic drop, like my thing I can refer to and stop arguing about this one. So secondary claims have come up, and these weren't always there originally, but there are things that they say now to try to support the original ideas, and just to cover those as well. Some of them are not even that important, but they're just signs of, not thorough scholarship, not really being aligned with how we know things work in the world and in the body. One claim they've made is that iodide and iodine supplements work differently. And I've seen a lot of websites put a lot of wording into the critical ratios of iodide to iodine. Some have argued, like there's an image here showing how iodine works in the breast and the prostate, but iodide works in the thyroid, the salivary glands. So what's happened? What's true about all that? Well, we know that in food, iodine ends up being in the chemical form of iodide, as does iodine supplements. I've even seen analysis of Lugol's iodine or SSKI, and iodine is so unstable, it doesn't persist. It becomes quickly broken down to iodide in solution. And even if you were to get exposed to iodine, well, it's harmful, it's dangerous, it's a free radical form, but even if you were, your gut reduces it into iodide. So even if you were ingesting iodine, your gut makes it all into iodide. So there's no iodine in circulation in your body except for when you form it within your thyroid. And because iodine is so volatile, the excess of that is what harms the thyroid and triggers thyroid disease. That's why your thyroid depends upon antioxidants like glutathione or superoxide dismutase, because iodine is a chemical hot potato. It's a tough thing to have around. Another claim I've seen made is that the body stores massive amounts of iodine all over the place, like 1,500,000 micrograms. I've seen that stated. Here was a slide from a presentation saying that all organs and tissues contain iodine, that there's these huge amounts in the fat. Striated tissue, kind of a funny phrase, must be referring to muscle tissue. But this has been studied pretty well too. And we know that from analysis, from radiographic analysis, that adults have about 15 to 20 milligrams of iodine in their whole body. And most of that is in the thyroid. So with 70% in the thyroid, 70 to 80%, that means that outside the thyroid, there's not going to be high quantities. There's just a couple milligrams. So there's not any known concentrations of iodine in the fat, in the muscle tissue, and there's not that much in the thyroid. There's just a little bit, and that's pretty much where all of it is. And this is not a controversial point. Okay, here's a big one that does come up a fair amount. There's an argument that iodine is protective against breast cancer. And the logic on this is really the observation that the Japanese have a higher iodine intake and they have a lower rate of breast cancer. And it's plausible that that could be a factor. And it is true, I mentioned that the breast tissue does have iodine receptors. It's got the NIS transport mechanism. And that's there because it needs to concentrate iodine for breast milk. So if iodine were protective, and if the reason that Japanese women have less breast cancer is because of their iodine exposure, well, we should be able to take these women and look at their iodine levels, and those with the most iodine should have the lowest risk for breast cancer. Some Japanese still get breast cancer, and some do, some don't. And if iodine is protective, then iodine should be protective, and the ones with the least iodine that don't have higher iodine, they should be the ones getting breast cancer. However, that's been studied, and the exact opposite showed up. It turns out that across ethnicities, urinary levels of iodine, they are predictive for the presence of breast cancer. There's an image here from a study that showed just that. So they've even talked about whether or not iodine could be used as a screening tool to see who's at risk for breast cancer. Those who are highest are thought to be most at risk. And it doesn't end there. There's also research suggesting that iodine, because it's so specifically, it is taken up by breast tissue, that it could be a target for cancer treatment, that they could use radioactive iodine to treat breast cancer the same way they can for thyroid cancer. So no, the evidence we have right now is that the exact opposite. There never was evidence that iodine was protective against breast cancer. The extent to which the Japanese have lower risks for cancers probably are due to many other factors. Probably the biggest single one is just the smaller body weight. That's one of the biggest known drivers of breast cancer. But what we've seen is that the Japanese do have good health, but they don't have better thyroid function. For one thing, their iodine intake is not that high. It's not as high as they've made out in the Iodine Project, but it is higher, and they've got twice the rate of autoimmune thyroid disease as they have in the US. And they've got about 3 times the rate of mortality from thyroid cancer. So that's the drawback. And that's with some level of iodine adaptation. They've had a diet very rich in seafood and sea vegetables for quite some time, and they are more genetically homogeneous. So they've had time to adapt, but even with that, they do lead the world for these types of thyroid disease. And those that are highest in iodine are most apt to develop breast cancer. Another claim I've seen recently is that there are these iodolipids, there's these iodine compounds that protect the whole body. And the argument goes that these things are only made if you're exposed to iodine way above the RDA, and that they protect all your body's tissues from cancers. So that's the claim. The main compound in question is called iodolactone. So this is kind of grasping at straws, because the quote is saying that this is in human tissue, not detected human tissue when iodine deficiency is present, but it is there when they consume 100 times the RDA. There's no data whatsoever about iodolactone in humans. I'm sorry, I dug deep to try to find something along these lines. And the only data we have on it comes from tissue studies, from cells, not even human cells, but cells looked at in a microscope, or from animals. And the story is not that you take iodine and this thing is helpful for you. This thing is there, and then if you take cells and like pour iodine on them, they make a little more of it. But it's not saying that animals that consume more iodine have low rates of cancers, and it's not saying that humans even make this stuff. It may not even be present in humans. So it's a bit of a stretch, in all honesty. So those are the core claims. I haven't really found any others. If I do see some big ones, I might have to revise this, but I hope not. I'm kind of done with this one. So yet, how could someone say this is helpful? There are those who say, I use this clinically and it helps my patients. They do better for that. How could someone claim that? Well, for starters, we don't know if it really does help. You know, if you make a claim that's contrary with a century's worth of biomedical literature, you would need massive evidence to back up that claim. And I don't see that evidence. The first thing would be doing peer-reviewed tracking of clinical outcomes for your patients. That hasn't happened. If you do research the clinical outcomes for people following these approaches, they're not good. There's numerous published studies of adults and babies that were harmed by this approach, but there are no peer-reviewed studies that they've done showing better clinical outcomes. And there are numerous clinical studies showing the exact opposite, that these are the things that cause thyroid disease, they're harmful. So there's that. The other thing is that with all of that, I do believe that these are sincere people. I do believe that their patients are probably seeing their health get better often. I think there are many patients that they lose to follow-up that do worse, that they don't hear from, because we've seen many of those patients, but I don't doubt they do help some people. And how could that be? Well, they're not just doing iodine. You know, they're doing a pretty broad range of many things that are good ideas, dietary approach, helping other hormonal abnormalities, doing thyroid replacement in ways that probably should have been done already, but they're doing a lot of good things. And you could do 10 good things and one thing that's not good and have a net positive outcome. That totally can happen. But let's figure out what's working and what's not working. And let's try to get all the things we're doing. Let's get everyone rowing in the right direction. That's the basic thought. So to summarize, you know, this whole Iodine Project and wrap it up. Again, I don't question anyone's sincerity or their intentions, but I do see this as a lot of confirmation bias. And this is a big pitfall. You know, once you start thinking that things work in a certain way, it's very easy to pull in any data that seems to support that and hold on to that. And it's very easy to reject any data that seems to contradict it and find some reason to poke holes in that. But this is a real classic example of that fallacy. You know, this came about by one small mistake, by thinking that fibrocystic breast disease was benefited because of an unknown nutritional effect, rather than just a simple known pharmacologic effect. So to encapsulate all the main points, most people in the modern world have enough or too much iodine. The severe iodine deficiencies of the past are gone. We do have some nations at moderate and at mild iodine deficiency, but there's fewer of them. There are more nations at iodine excess, and the US is one of those. Another point is that iodine is not harmless. It can be fatal, it can be toxic, and there are known complications across the board in the body with massive doses, and the further doses get above 200 micrograms, there are known complications with all versions of thyroid disease. Iodine can slow the thyroid. The Wolff-Chaikoff Effect is real. It's not crying wolf. We rely upon it every day in medicine to manage Graves' disease. Halides don't block iodine. They can be harmful in amounts outside of common daily exposure, but the amounts of chlorine or fluoride or bromide that we're exposed to from our diets, from food, from routine things, are not harmful and do not have any measurable effects upon thyroid function. Urinary challenge tests are not accurate tools. They have no validation. The only study that I've seen comparing them to other methods shows that their premises are not valid. The urine doesn't reveal all the iodine in the first 24 hours. Most of it takes 30 hours, and it keeps on going for days and days afterward. And then finally, iodine can cause a high TSH, and that is significant. That is hypothyroidism, and that is the source of many symptoms and much suffering. So what do you do with all this? Well, iodine is safe for most humans in the range of about 50 to 200 micrograms. You want to stay about there. If you're pregnant or nursing, it's a little bit higher, probably about 150 to 250 micrograms. For those that don't have thyroid disease or aren't prone to it, you can have higher amounts on occasion, and it's probably safe. No real reason to, but you can. But the most exciting part about the new research is that regulating iodine, getting it to that therapeutic range, may reverse Hashimoto's hypothyroidism and subclinical hypothyroidism. We now have numerous studies showing that. So thyroid disease can get better. All right, if you made it through, high five, good job. Dr. C with you, and I'll see you real soon. Bye-bye.